introducing herself.
Okay.
Okay.
Yeah, down for
Let me jump
that.
into
Okay.
Wait.
All right. Should we go live? We're ready.
Yes.
All right. Let's do it.
Let's do it.
Let me just go live in every single page. Go live. So we're gonna go live on YouTube, Instagram, and Facebook at the same time.
Excellent. Just waiting for
Okay.
us coming live.
Okay. We are live now.
We are live. Awesome.
We are live.
Just gonna find our live so I can look at the feed.
Camera. I guess this is it.
Here we go. I can see it.
Yeah.
Brilliant. So,
All right.
understanding back pain.
Yes, understanding back pain. How you doing today, Daryl? You good?
Good, good. You, Pedro?
I am good, thank you. Should we
Excellent.
kick off?
Do again?
Should we kick off?
Yeah. Let's go for it.
All
Let's
right,
dive
let's
in.
do it. So let me just quick bring it to stage. The slides that I put together. So welcome, everyone. Today's live session is about understanding lower back pain from both a physical and an emotional point of view. I'm Pedro, your physical health coach.
I'm Daryl, your emotional health coach.
Great. So today we're going to unpack why lower back pain happens and how a holistic approach, one that considers your body, your emotions, and your daily life, can make a real difference. Yeah. Um, let's move forward now. Just our mission as Vita is to help women understand, reduce, and eliminate back pain through expert guidance, simple strategy, and a supportive community. Yeah. So let's jump straight into it. Today's agenda, we're basically starting with this quick intro. I'm going to dive straight into the physical health part. Daryl will then jump on board with the emotional side of it, and then we can finish with Q&A. All right. So, understanding lower back pain from a both physical and emotional perspective. So, today we're going to unpack why lower back pain happens and how a holistic approach, one that considers your body, emotion, and daily life, can make a real difference. Okay, so let's start by acknowledging that lower back pain is a complex symphony. Yeah, there isn't just one instrument at fault. Sometimes it's a string, sometimes the percussion, and other times might be the violins. In our case, lower back pain can be triggered by a host of factors. So let's start with a simple idea. Think of your lower back pain as a bridge, okay? Just like this one here that you can see. Um, for that bridge to be strong, it needs solid pillars, your muscles and your hips and your core. So you can see here some really deep and really important muscles to keep your back strong and healthy. So for example, this one right here on the left, the first image is the hip flexor. Okay, the deep core muscle is very deep. This is the only muscle connecting your upper body to your lower body. So it's really important. Down here, you can see that your lower back is actually a mix, a combination of a whole bunch of muscles working together. Okay. The next one over is the deep core muscles, the muscles responsible to keep your spine healthy and stable. And below, the glute muscles and your hip muscles, also really, really important. If your hips are not functioning well, your lower back will suffer. Yeah. So when those pillars are weak or unbalanced, the bridge can start to sag and creak. That's when you feel pain. There are many reasons why your lower back pain might hurt. Sometimes it's because of habits like sitting too much or slouching. actions that create muscular imbalances put extra stress on these muscles. Make sense? But other times, pain can come from tight and weak muscles, like in your hips or your core. But this is really important. Conditions like sciatica or even bulging disc can develop when there's too much strain placed in the nerves and muscles surrounding the area of the pain. Let me go like this. Now, imagine carrying a heavy load on an old wobbly bridge. Over time, that strain can lead to problems. So these are the kind of issues we can work on with the right exercises and lifestyle tweaks without the need for injection or surgery. However, big however, let me just move forward. Again, if those foundations are not working in sync, you will suffer back pain. Okay, so you've got to watch for your hips and your core. Really, really important. Like I said, bulging disc. Now, when all these muscles are not working as they should, for example, bulging disc, yeah, a chain will always break on the weakest link. If your core is unstable, if your hips are not functioning properly, the discs are the ones that are going to suffer the most. When it comes to sciatica, with it, when all the muscles surrounding your hips are tight and weak and not functioning as they should, there will be more pressure in certain muscles. Certain muscles will have to work overtime, and then they get inflamed. Yeah, sometimes some of these muscles can push into the sciatica nerve. So addressing this, getting your hips to work as they should, you should take some pressure off of these structures, and this should help with your back pain. Okay. Now, not all back pain conditions are the same, and this is the big however. Okay, sometimes pain can be due to other reasons, okay, like kidney stones or infections or conditions like endometriosis. So I'm just going to run through some of these conditions here so you know that these are real serious condition that you can only be addressed with your GP. So kidney stones or severe internal abdominal pressure or inflammatory conditions like rheumatoid arthritis, endometriosis, spinal infection, vertebral compression fractures, like you had an accident, yeah, severe spine stenosis or advanced degenerative disc disease. Okay, and there's more. Metastatic, metastatic spinal tumors or other cancers can be a reason why you have back pain. Severe scoliosis or congenital structural abnormalities. Yeah. Advanced disc issues requiring surgical intervention. Now, any of these onset neurological symptoms, numbness or weakness or loss of bladder or bowel control, these means that you have to see the GP immediately. Yeah. So if you are experiencing symptoms like severe pain, numbness, weakness, or loss of control, it's crucial that you consult your GP immediately. These are signs that your body is trying to tell you something important that requires a GP attention. Think of these warning lights as your car dashboard. Okay. If you see them, if you feel them, it means that you need to visit your doctor right away. Okay. Make sense? All right. Now, today we just want to focus on the types of conditions that we can really help with. Yeah. Okay. Let me go up here. This is later.
Cool.
So, when your core and hips are the bridge, your core and hips are the bridge between your upper body and your lower body. When your core is strong and your hips move well without muscular imbalances, your spine gets the support it needs, and your pain can lessen or eventually disappear. So these exercises and changes in habits are like a tune-up for your body, helping everything work smoothly. Picture your core and hips as the foundation of a house. When it's solid, the entire structure is more stable and secure. So by strengthening these muscles, we help correct poor posture, reduce muscular imbalances, and alleviate pressure on areas like bulging disc and sciatica. Additionally, managing weight and staying active with care, applying a curious mind, like we spoke in the previous live session, can take a lot of stress off of your lower back, much like lightening the load on a well worn bridge. Okay? Now, I want to introduce you to a simple concept. Not very simple, but it's a concept called biopsychosocial model. And you might be wondering, what the fuck is this? Yeah? Let's get into it. So, this model views lower back pain as a result of an interplay among three key factors. Okay? Biological, so your physical body; psychological, your emotions and stress; and social, your lifestyle and environment. Imagine a three-legged stool. Yeah? One leg represents your body, the other one your mind, and the third is your everyday life. If one leg is weak or missing, the stool can't stand and function as it should. In the same way, if your physical health or emotional well being or daily habits are off, your back pain can worsen. Okay, we need all three parts to be strong to keep you feeling good. One big part of this is stress. Let's go forward. Stress. When you're stressed, your body goes into a kind of a alert mode, like an alarm that is always ringing, which is also a protection mechanism. Now, this constant alarm makes you more sensitive to pain and alert to anything and everything around you. Reducing stress is like turning down that alarm, allowing your body to relax and heal. Daryl will go more into detail, but like techniques such as deep breathing, meditation, or even taking short breaks during your day can help lower your stress, and with that, ease your pain. In our approach, the Vita method, we address each leg of that stool: your body, your mind, and your lifestyle, to ensure you have a balanced and resilient foundation for long term relief. Now, Daryl will talk in more depth about the emotional health of your lower back pain.
Awesome. Thank you, Pedro. Well, hopefully now you're beginning to get an idea of the physical causes of back pain and know whether or not it's something that we can help you with the Vita method. So one of those things that is on that list to check your GP, go and do that. But if it's structural, if it's mental emotional, then we can certainly help you. A lot of people seeing that presentation, you might watch it and you might see, okay, I've got a weak muscle here, or I've got too much pressure there, I'm slouching at work. It must just be purely physical. And if you think that, I'm going to challenge that belief for you tonight, okay? Because lots of emotions, as Pedro mentioned, stress in particular, anxiety and trauma, these are big things. They can contribute to and potentially even cause back pain all on their own. And I'm going to explain how that works so you understand. There are also other emotions like anger, jealousy, rage, shame. We're going to address those in the Vita program, but for tonight, I'm going to focus on the main ones. Okay. So, how does stress cause back pain? This is the mind body connection. Okay. So, stress, you'll be familiar, triggers fight or flight. So, this is an emotional or psychological threat that's perceived by your brain. It might be real and it might be not real. You might just be sitting imagining something bad that could happen, and your nervous system gets activated. Then stress hormones are released. So cortisol, adrenaline, these go into your body to prepare you to deal with whatever's threatening you. Your heart rate is going to get faster and your blood pressure is going to go up. This helps get more blood around your body and more oxygen to your tissues. Your breathing's going to get faster. Your muscles are going to get tense, particularly in your back and in your shoulders. Your pupils are going to dilate to pull more light in so that you can see better and improve your vision. Blood flow is going to be directed to essential functions in your body away from non-essential. So your digestion might suffer. You're going to be in a high state of alert. So with all this happening, muscle tension is one of the big things, because if you think about it, imagine you're about to get bowled over by a tiger in the jungle. What you want is to not shatter into 100 pieces. So you want to be able to just kind of tense and just be there, just be strong. And so your muscles do that all on their own. You don't have to think about it. If you think about a can of soda, right, a Coke can, if it's empty and you stand on it, it's just going to squish. But if it's full, it can take a lot of pressure. You can stand on it, jump on it, and it will maintain its shape. So your body, your core, and your back, it really wants to maintain its shape when there's stress or tension. The problem is that's all good if there's a short threat, if there's a brief moment when something's threatening you. But what if that's chronic? What if this is over time? What if this threat continues to be present? In that case, it's going to be more than just a little bit of extra muscle tension that you're going to have. You're going to have increased blood flow to the muscles. You're going to have increased inflammation for repair, but that can lead to that persistent or chronic back pain. Inflammation in the muscles can squeeze out those nerves, but there's even more. Prolonged stress, chronic stress, actually enlarges the amygdala. So the amygdala is in your brain. It's like this little emotion center, which senses threat and it tells your body to get ready for it. And the more that you're exposed to danger over and over, the more sensitive your amygdala gets, the bigger it physically gets so that it can process more danger. And that is going to make pain a much bigger problem for you. So let's look at that. First, you have stress, right? Danger, fight or flight. I'm stressed. Then cortisol is going to be released, a stress hormone. This is going to raise your blood sugar levels. It's giving you money. Maybe it gives you money. It's going to give you energy to fight or flight, to run. Okay. Cortisol makes the amygdala larger, more active. This is going to heighten your emotional response, not just to the danger now, but the danger later as well. Your amygdala, if it is triggered over and over and over, so there's constant stress in your life over and over and over, it's going to be more sensitive. It's going to be more sensitive to pain. It's going to be more sensitive to anything else that's happening. So normal pain that would have felt normal to you at one point, with a bigger amygdala, with heightened sensitivity, you're going to have a stronger perception of that pain. It's going to feel worse. And at the same time, stress actually reduces areas of the brain's activity that might have helped you. So the prefrontal cortex, which normally is going to help you regulate pain, this is going to be interfered with. So you're going to feel like the pain is worse than it is. And as we all know, it doesn't matter if we're simply feeling it or if it's real. If it feels bad, it's bad. It's all the same. Your brain works by use it or lose it. Okay, if you're signaling to your brain over and over that there is pain, then your brain is going to rewire to pay more attention to that pain. Your brain is going to think that that pain is really important. Pain is meant to resolve when the issue goes away. So pain is still there. Your brain is going to take more and more computing power to actually look at it and deal with it. This way, pain in your back can get worse over time without the back getting worse over time. It's just the way that your brain is paying attention to it. This can lead to an emotional feedback loop, right? So emotional stress, muscle tension, pain. The pain then increases emotional stress. Emotional stress, tension, pain. And it just goes on a loop, getting worse and worse over time. If you have back pain, I'm pretty sure you've noticed it flare up during times of stress and anxiety. Would that be right? I think so. An argument, a stressful situation, any of these things could lead to stress and tension and more back pain. And then now, the back pain's flaring up. Now I'm stressed. Now I'm in more pain, right? So just remember that there is an emotional component. We're going to help you with it, okay? Emotional events, individual events, can also anchor themselves in your body. So let's say you have a bad encounter with your boss one day and it causes stress and it causes a flare up of back pain. Now, in the future, because your body remembers, you might get a flare up in your back just by going to work. You might get a flare up just by thinking about going to work. This is how the brain and body works. Now, I'm going to move a little bit into trauma. So, trauma expert Dr. Paul Conti defines trauma as an event or a series of events after which there is a negative adaptation in the mind and or body. So, when we think of trauma, this means trauma isn't just a big stressful event by itself or a series of events, but it's the way that the body and the mind adapt negatively afterwards, which can lead to emotional, psychological, and physical consequences. These negative adaptations can manifest as chronic stress, pain, and it's going to affect you over and over and over, right? Trauma memories are usually not processed properly, but they can later be with therapy, okay? This can lead to overgeneralized fear and emotional responses. So, what does that mean? That means that if you've had trauma in the past and you've got these unresolved trauma memories, then things that would not normally be stressful to you might appear stressful. Things that might not normally be arousing or scary might become arousing and scary. And so that means that you're getting affected more negatively by those stress hormones and the tension in your back until that trauma is dealt with. So some of the negative adaptations from trauma might be increased anxiety, hypervigilance, avoidance behaviors, procrastination, chronic stress. Physically, you might have chronic pain, such as in your back. You might also have sleep disturbances or other stress-related symptoms. Prolonged activation of the stress response is going to lead to what? Muscle tension. It's going to lead to inflammation, physical symptoms, particularly in areas like the back. So, as you know, trauma triggers the release of stress hormones like cortisol and adrenaline, keeping the body in a heightened state of alert. Trauma leads to stress. Stress leads to changes in the brain. Let's look a little bit at that. We talked about the brain rewiring. This ability of your brain to rewire is called neuroplasticity. Chronic stress and trauma can reshape your brain. The amygdala in your brain, the part that senses emotions and triggers a response, can become hyperactive, increasing emotional reactivity, increasing your fear response. By increasing activity in the amygdala, this makes you more sensitive to pain. But it's not just that. Having trauma or having pain over time can lead to problems with your hippocampus. This is the part of your brain that's responsible for memory and learning. When this is impaired, it gets difficult to contextualize past from present, to deal with the situations, to deal with the problem in the now as if it's in the now, and not take problems from the past into the present, not to project things into the future. But it also interferes with your prefrontal cortex. This is where you make your decisions in your brain. This is where we do our problem solving. And it helps with emotional regulation by telling us it's okay, it's actually safe, you can calm down. So reduced activity here, which is what you're going to get as a result of trauma or chronic pain, this can lead to weakened emotional regulation and impaired decision making. Okay. So all of this sounds a bit scary, but don't worry, we're going to help, okay? Emotional stress, though it can reduce the brain's capacity to process pain logically and heighten the experience of pain, the reverse does the reverse. So sorting out the brain, processing trauma, dealing with emotions, it's going to allow you to make better decisions, to process pain better, to feel pain as it's meant to be and lessen that pain, not overreact to it. So trauma leads to stress. Stress leads to changes in the brain. Changes in the brain leads to more pain, but that can be reversed. Okay. Pain reprocessing, can't say that word. Pain reprocessing techniques that use neuroplasticity can rewire your brain's response to pain. These are part of the Vita method. If you do the emotional program, it's going to include pain reprocessing techniques that use neuroplasticity to rewire your brain's response to pain so that it feels less, so that your brain's not preoccupied with the sensations in your body. Okay, so what do you need to do? Well, You need an emotional release. That's what you need to do. The Vita method, as well as having the physical movement, which of course helps reduce stress all on its own, separate from what it does for mobility and flexibility and core strengthening, doing any kind of physical exercise or activity is going to help you cope with stress better. But the Vita method also includes meditation, hypnotherapy, neurolinguistic programming, therapeutic journaling, techniques designed specifically to help you. It's going to help you break that loop. That's what you got to stop. It's the loop between the situation, the back pain, the emotions, the brain. It's going to help you stop by becoming aware of the emotions, by becoming aware of the effect of them on your body and your brain. You're going to be able to intervene and stop that. Now, you might want to do this on your own. That's absolutely okay. You've got somewhere to start now. You might want to do this with a therapist. Brilliant. If you've got severe trauma, then probably you want some one-on-one therapy as well. But a lot of stuff can be processed directly with the Vita method. So we can help you rewire your brain, reclaim your thinking brain, and leave less space for unnecessary pain processing. Now, in my clinic, I've had great success with back pain, with pain management, but Pedro and I, we wanted to go beyond what we do one-on-one, and that is why we're reaching out to you. So if there's somebody you think this can help, then share a video, share a page with them. Remember, back pain, it's not just physical, it's totally intertwined with your emotional health. So if you understand the root cause, you can reduce or even eliminate your back pain. If you want to get started today, join the Back Pain Relief Hub or go and sign up for a free 14-day challenge. Pass it back to you, Pedro. Thanks for listening, guys.
Thank you, Daryl. This is awesome. So many gold nuggets. I love it. So, a quick recap of what we spoke about today. So, your lower back pain have multiple causes. Yeah, your lower back pain can come from bad posture, weak muscles, or even more serious illness or issues. But only you can tell that. So, if it feels weird, if it feels, I don't know, different, or you're not sure about it, check it. Yeah, don't be reactive, be proactive. Um, Two, our focus. We can help with issues like poor posture, muscular imbalances, and stress by strengthening your hips, your core, improve your flexibility, improve your emotional wellness, which is going to take some strain off of your back. And a holistic approach. Your body and mind, they work together. By reducing your stress is just as important as strengthening your muscles to ease your pain. Okay. Now, what can you do? What should you do moving forward? So let me quickly briefly talk about the Vita method, which is basically a three-step process. The goal is to help you understand, reduce, and eliminate. And we've got all the tools for free to help you get through these with ease. The first one is learn. Yeah. You cannot change what you don't understand. So we want to give you as much knowledge as we can so you can make better decisions because only you know what you feel. So learning is the first step. Two, not everyone is ready to action on it. If you are, we can help you. We've got a 14-day lower back pain challenge for free to get you started. Yeah. And three, it's a 90-day back pain mastery, which we go a lot in depth. But take step one and two. If you like what you see, if you feel any difference, we can think about step three. Yeah. Now, what can you do moving forward? Again, learn. So you can join our community. It's a free community designed for women to share experiences, to have video or exercise reviews, to talk about stress. Me and Daryl are there so we can answer your questions. The replays will be there. So it's a small group, which means that if you joined, you're gonna have access to us like anytime. Yeah. Um, if you decide to join, we're going to give you for free our ebook. It's more than 20 years of experience condensed in a 20 minutes read. So you will get that straight onto your email when you join the community. If you want to take on the challenge, you can do it. You will download an app and we'll guide you through everything via the app. Okay. And then there is the 90-day back pain mastery, which we can talk about it moving forward. But overall, I am really happy with today's live session. We covered quite a few things. And yeah, thank you for you that is watching. It might not be live right now, but you can watch the replay. Comment below how you're feeling, and how we can help you. And yeah, that's us.
That's us. Thanks. Any questions, please feel free to type those. I can see you guys are resonating with what we've said, got some food for thought. And again, those questions don't have to be now. So you can pop something in the group and we'll come and we will answer those. You have a direct line to us in that group, free to join. So awesome.
Perfect. Well, it's been 30 minutes. I hope you guys enjoyed. Thank you so much for your time, Daryl.
Thanks, Pedro. See you next week.
See you guys later. Bye.
Bye-bye.